together, because now I'm with my parents, I'm just working, and every day is the same to me. So I almost can't even tell, to be honest. That's the funny part. But yeah, so today was a productive day. Pretty much what I did was I recorded a whole bunch of lectures for my coaching program, scripted some lectures, uh, did some posting on LinkedIn. I wanted to go for a walk, but I was not able to go for a walk because of how it was raining outside. So I'm gonna go for my walk and my gym tomorrow. So that's gonna be the game plan for that. Try to do about 3 days a week, and usually that's enough to get me going. But yeah. Other than that, that's the main thing. I think tomorrow what we're gonna do is also I'm gonna be recording more lectures. I'm gonna record a sales video, and yeah, like I was actually just thinking, people talk about locking in, and the way to really lock in is to just like, it's not to try harder, it's almost to try less. Like, you want to just be doing less shit. You want to be removing stuff from your life. So the way that I tried harder was literally, like I left New York, went to my parents' house, and I just sat there, and I was like, okay, I have no friends here. I didn't bring any of my games or anything. Like, all I have is work. Like, that's the only thing I have available. So I'm like, well, like, I guess that's what we're gonna be doing, and that's what's happening. So all right, looks like we're kicking in. So Jess underscore city to farm says, I was switched from Abilify to Olanzapine because of nightmares. I'm worried about weight gain. I don't think olanzapine will help with nightmares necessarily. It's not really a nightmare med. Uh, it might help you sleep a little bit better. That's the main thing. But weight gain is definitely a thing with it. So there's a couple things that you can do. You could add on, if you want a med solution, you can add on metformin. You could add on something like a GLP-1 agonist. You can add on topiramate. Those are more med solutions. If you want non-med solution, you just have to be more mindful of your eating, like way more mindful. So basically, I would start tracking your calories. I would start making sure that there's no junk food in your home, right? That's the easiest way. I always give the story when I'm at home. I used to have this craving for dessert food, and like I used to always, after every meal, like have a dessert, like ice cream or chocolate or something, and it made it really hard to be able to manage my weight. And like, especially when I was trying to get lean, I would check back like, a month or two later, I'd be the same. I'm like, WTF? And like, why isn't this working? And then it's because of the junk food, and then or the desserts. And so what I did was I switched over to Quest bars, and now I only have Quest bars and protein bars as desserts in my house. So I'm not tempted. And now here at my parents' house, they have a lot more desserts. And so to them, I'm like, no, keep them away from me. I'm just gonna have Greek yogurt. But I still used to eat some of the desserts. Like I eat some of the protein bar, or like not protein bars. They have like burfi, like Indian burfi, which is basically like an Indian sweet, and I eat that. And so I'm like, well, frick, this is, and the only reason I do it is because it's there, and it's like tempting to me. But if it wasn't there, I wouldn't want it. So my point is that if you can manage your environment when you switch to a high weight gaining antipsychotic like Abilify or Olanzapine, then that will help you a lot with managing weight gain on it. So yeah. Hey, how are you doing? Nice. I have been on a journey. I've been eating nothing but fresh food. I feel great. Yeah, that sounds awesome, honestly. Eating clean whole foods, that's what I'm doing. Right now I'm on a low carb diet. I only eat meat and veggies. I eat meat, veggies, some Greek yogurt, berries, and then like a little bit of dessert, like chocolate, or like the burfi I mentioned. Like that's it. I don't need any other carbs, and like I feel great. Yeah, because like especially because the core of my diet is just protein and veggies. Like I make that the base, and then everything else is like the dressing. The analogy I give, it's like if you have a rock. Basically, if you have a jar, you need to fill it with the big items first, and the big items are rocks. So you want to fill your jar up with rocks first, And then once it's filled up with rocks, then you can add in the sand. So the rocks are the core, right? My diet is the protein and the veggies. That's the core of the diet. And then the sprinkles on top is like the dessert. So that way I get the treat, but the core is still the foundational protein and nutrients and staying within my calorie budget. So yeah, I would say that's the way to really manage the weight. I'm down to 0.25 alprazolam at night after years of high dose. How many weeks do you suggest I stop? It depends on the person. If you've been on it for years, then maybe you want to wait a little bit. You could even cut the 0.25 in half too. So it just depends. Some people are able to get off quicker. Honestly, you could also probably just switch at that point. You could just switch it to Valium and then get off the Valium. That's easier to get off. So yeah. Hi, Psych Dad. I've never heard that one before. I've heard Psych Daddy, but I haven't heard Psych Dad. So I'll take it. Does lithium cause weight gain? It does. Yes, it does. Endocrine isn't sticking. Yeah. Oh, that's fine. I loved endocrine. That was actually one of my favorite subjects. Excuse me. I loved how in endocrine everything kind of flows together. Like this, it's like the hypothalamus secretes corticotropin releasing hormone, which goes to the pituitary, which releases ACTH, which goes to the adrenals, which releases norepinephrine. Like it's like very like systematic. So if there's problems, you can track it in the system. Like I always thought that was so cool. But I never wanted to be an endocrinologist because the main bulk of their work is diabetes. And that's just not something that I was interested in treating. So what is your opinion? Take my final from me. I refuse. I've done my time. I also liked organic chemistry too. That was one of my favorite subjects back in the day. 2 days into Pregabalin, I'm feeling bad side effects. Could Lamictal help with anxiety? Lamictal's not really an anxiety med. It's more used for depression, bipolar depression, treatment-resistant depression. But like anecdotally, I've heard that people say it helps them with anxiety, so like it could. But also 2 days into a med is too soon to judge it for side effects. It can take a little bit of time. I'll give you 500 to take my final for me. This is giving me high school flashbacks. Do you know if Quetiapine... I remember I had a buddy, his name was Ashu, and we had this chemistry project. It was like a long-ass chemistry project that we had to do. You just unlocked a memory for me. And I remember we had this, white blonde girl in our class, and it was literally the most classic thing. So, rich girl. So she paid our buddy, Ashu, right, who's a nerdy Indian guy. She paid him, I think, like $200 to do her science project for her. And he did. And he did. Medicine is so vast, I'm planning on joining surgery residency. Nice. Congratulations. Do you think a dose of 300 quetiapine a day is too much? Used as a mood stabilizer and for sleep? I don't think 300 a day is... That's a solid dose. Like, I like that dose. I think that's a solid dose. It's not too high, but it's not too low. Like, it's a good mood stabilizing dose. Awesome. Thank you for the sub. So just remember, if you sub, I can prioritize your questions over everyone else's because I get a big notification saying that subs are messaging. Let me see, how do I do this? All right, so for example, Andrea Rastelli 787 says, can parathyroid and high calcium cause bad anxiety? I'm sure it can. So I'm trying to remember how the hormonal stuff of parathyroid works, but thyroid definitely can. If you have high thyroid, that definitely causes anxiety because that releases, T3, T4. Parathyroid releases, I think a hormone, like it releases calcitonin and PTH, I think, parathormone. But I'm sure it can. If you have a high parathyroid, probably have a lot of inflammation going on. Buspirone is a junk med in general. Yeah, it's like mild to moderate. It's not like that great. Everything causes me anxiety. RIP. I think my Lexapro quit working. I mean, just because something, oftentimes hear people say it quit working, which is possible, but oftentimes there's just more life stressors than just the med can handle too. Remember, the med is just a tool to make you be able to handle all the stuff in your life. Like, it's not going to magically fix everything. It just decreases the intensity of symptoms. So, like, I remember one of my patients told me that he was on Adderall, and he's a lawyer, so he works long hours, and so he says if he doesn't sleep, he notices that Adderall doesn't work as well. But when he sleeps good, the same dose of Adderall works great. So that can contribute too, like lifestyle factors can all contribute into that as well. So everything kind of stacks together. Is it safe to take Trazodone and omega-3? Yeah, those two are pretty safe. In fact, I prescribe omega-3s a lot. I always tell people, like, if I could only choose one supplement to recommend for the rest of my life, it would be omega-3s. Like, that would be the thing that I would go with. I think they're good mood stabilizing, they help the brain, they help signaling. The brain's literally made out of, like, it's the omega-3s, they literally makes the fatty acids of our brain cells. Which one of my meds is causing my muscles to fire as I fall asleep? That is hard to say, my friend. So that's where you could book a consult, and, like, so if you want more insight into your situation, that's where I'd recommend booking a consult, because then you could actually I can actually look at your situation in more detail, and we can see if what's going on. The best way to do that is just check out my bio. Is there an omega-3 gummy you recommend? I don't recommend omega-3 gummies. They're too low dose. Most supplement places will scam you because they'll say, oh yeah, this has like 1,000 milligrams. Trader Joe's does this. And I'll never forget, a patient came up to me and I was telling her about omega-3. She's like, oh yeah, I take omega-3s. I'm like, what one? Trader Joe's. And so I looked it up and I was like, oh, so this says you take 1,200, but the fine print, the EPA and the DHA, which are the active ingredients, are 600, and the rest is just filler. So I was like, oh, so now you're getting filler done. Basically, you're having filler in your omega-3, just like you get your lip filler. You're literally filling it with junk for your omega-3. So that's how I realized that, yeah, all these companies will scam you. But if you want a good omega-3, yeah, I would check out my I have a showcase on TikTok, so check that out. If you check out the bio, and then you can see the omega-3 I recommend. I like it because each one is 1,000 milligrams. My doctor changed my Venlafaxine to nighttime. Usually it's in the morning because it makes people awake, but some people get sleepy from it. Lol, at work today, the pharmacist was like, psych meds are the hardest to counsel on because they're so similar. Yeah. I mean, that's why there's literally, like, we're experts in our psych meds, right? Because, right, like, that's why we get all that training, psychiatry residency for 4 years, is because people think psych's easy, but it's not. Like, it's got its own challenges, and it takes time to master it. Should I be afraid to take prescribed Xanax short term? No, that's fine. That's fine. Omega-3 and AFib, yeah, you can take it. I mean, I wouldn't take like 20,000 omega-3, but yeah, the normal dose is fine. I'm saying that Venlafaxine in general is usually prescribed in the morning because it tends to be more activating. It makes people awake because it stimulates norepinephrine. However, some people may get sleepy from it. They have an opposite reaction, so they take it at night. So it just depends. Can you be my psychiatrist? Yeah, so if you want to work with me, best way to do that is just to book a consult in my bio. That's the best way. What are you drinking? So this is turmeric and chamomile green or tea. I always drink it when I go on these late night lives. This is always the most fun part of my day, honestly. It's like I look forward to these lives. Like I pretty much just like put it all out, and then afterwards like my brain is shot. I'm like, okay, I'm done for the day. Like this is it. And it's like I work through the day to get to here. I was prescribed Remeron rear-ended a car because my foot wouldn't move to the brake pedal. That's not good. But remember, correlation doesn't equal causation. Because of W mods. Yes, W mods in the chat. Diet and exercise have helped me a lot. I've cut down my medication, of course. That's awesome. The analogy I use is that imagine that you are stuck at a bottom of a well. Medications are like a ladder that gets dropped down. It makes it easier to climb up the well, but you still got to climb. Meaning that you still have to put in the work to get out there. And so and then once you're out of the well, then you can take out your medication, you can remove your medication. So that's why diet and exercise help, because meds can make it easier for you to do what you need to do, and then once you've done it, you can remove them. What brand of omega-3? So check out my TikTok showcase, and you can see what brand I recommend. So I like it because it's got 1,000 calories, and it's like not as expensive either. Or not 1,000 calories, sorry. 1,000 milligrams of omega-3 per serving, EPA plus DHA. Chamomile and turmeric, yes. Do you have suggestions outside of SSRI? Yeah, SNRI, Buspar, propranolol. What does Seroquel help with? Mood stability, sleep. NTSP MHNP says, I am a Psych NP. Do you recommend a small dose of gabapentin for a patient for sleep? Maybe 100. I wouldn't use gabapentin unless there's some kind of comorbidity that you're trying to treat. Maybe you're trying to treat anxiety. Maybe you're trying to treat neuropathic pain. Gabapentin is not really a sleep med. It's like, it can be sedating, but it's not really a sleep med. I would only consider gabapentin if I had plans to titrate it in the future. Like, if they have neuropathy or they failed some other anxiety meds or something. But that's when I would use gabapentin. So I would use more things like Trazodone if I'm just trying to do sleep. If I'm trying to do like sleep plus mood stability, I'd maybe consider Seroquel. I had a patient who did really well in that, who had PTSD. Doxepin can be helpful for ADHD. You can use clonidine. That's really good for sleep. Yeah, melatonin if it's short term, but I don't really like that because tolerance builds. If you want something more natural, magnesium glycinate. That's what I personally take. That helps me the most, and I feel like I get some of the deepest sleep with that. So yeah, I hope that helps. And since you're a Psych NP, you might want to check out our coaching program too. So we had over 100 people join in the past like 45 days. So because I've had so many NPs reach out to me and they're like, hey, I never got good training. My program didn't teach me well. I don't feel confident. I need learning. I feel like I have imposter syndrome, like all of these things. And so because of this, I was like, okay, I need to, what one person literally told me that you're so lucky that you had a residency. Because like I did it and like I barely learned anything to survive. So that's why I created the program, actually. So if you check out my bio, if you're a Psych NP who really wants to learn psychiatry and you want to learn from me, that's what I would check out. What about magnesium L-Theanine? Yeah, I like magnesium threonate, or L-Theanine, you mean. Yeah, I use magnesium and L-Theanine. Psych NP here. Most Psych NPs need some school experience for going to school. Exactly. So that's the problem that's happening. So a lot of Psych NPs are being sold the lie that, hey, you just go direct entry, go from your nursing degree to Psych NP, you'll be great. But then when you don't have that experience, then you kind of get screwed, because then you just get thrown into a real job, and then you're like, what the heck? I'm seeing like 20 patients a day. Like, there's no way I can catch up. My psych preceptor doesn't really supervise me. The clinic just wants to make money. Like, they're not actually trying to help me. So they're just putting on patient after patient with me. And like, I don't even know if what I'm doing is right. And it's hard to tell in psych because people don't get better immediately. So you don't get that immediate feedback. And then furthermore, there's a lot of these like direct entry programs that are just like, hey, you can enter in, you can just go online, get your online degree, and like people just get horrendous training. And so, that's why I created the program, was because I'm like, okay, we got to fix this. Like, somebody's got to do something to fix this. And, I had so many people reaching out to me, and they're like, hey, can you be my preceptor? Can you teach me? Can you be my collaborating psychiatrist? And I was like, okay, like there's something more that I got to do. So yeah, that's where that idea came. It was killing our hospital service initially. Christina Marie MD says, it was killing our hospital service. Unfortunately, it helped initially, but they were so overwhelmed. What were they overwhelmed with? I teach psych NP students and PS students. NP students are always the weakest. Exactly, right? So the problem is that the PAs, so what happens in PA, right? So they're trained with the medical model. So they train alongside medical students, so they learn foundational medicine. Whereas NPs learn nursing. And so nursing is a different model where, it's more front-centered, you're in front of the patient, but you are trained to receive orders and not to give orders. And I'll give you a perfect example. So I moonlight for a prison, and at this prison that I moonlight at, like I'll have nurses who will call me, and they'll just like pretty much just like spend 5 minutes explaining some problem to me, and then they'll just like stop talking, right? So that problem could have been explained in like 30 seconds or a minute, and then second, there's no like solution thinking, right? It's just like, okay, here's a problem, and I'm just waiting to hear orders, what you want to do about it. And so I ask clarifying questions. Okay, is the inmate agitated? Okay, do you think the inmate's willing to take meds? Okay, do you think they're gonna self-harm? I'll ask those kind of questions, right? And then I make a clinical decision from there. But that's the key, like, is that I'm in the medical model, like I'm making the decision. And so, what some of my students have told me is that when they went from being nurses to nurse practitioners, it's a change from being a nurse to, receiving orders. So now you have to be giving orders. So now instead of just like kind of being in your silo, you have to be thinking about the whole patient, the whole picture, and suddenly you go from having no responsibility to having all the responsibility on you. And right, because if you mess up, then it's on you, right? You are the one who executed the order, or you're the one who gave the order, right? You are the brains behind the operation. And so that's something that I teach also in my program, is how to make that shift from, being just a nurse to now you are a provider. You are the one who's providing care for the patient, and you are the one who's making the orders. You're given the orders. So it comes with a different mindset shift that you have to adapt. They were great, but they were overwhelmed because we need more psych. Now, what kind of doctor are you, Christina? Oh, you are, family med resident. I see. Okay. I can see that. Yeah. And 1 million consult. Exactly, right? So that's the problem. And that's also from the nursing model as well, too, right? So when you don't know something, right, as a doctor or as a provider, you assume more responsibility. So, when I see a complex patient, like especially if it's like a psych case, like I can't consult. I am the person who's supposed to figure it out. But when you come from that nurse mentality, right, since you're trained to receive orders, then critical thinking is a skill that we haven't developed as much. And because we haven't developed that skill as much, it takes time to develop that. So that's why a lot, like you're saying, you get a lot of the practitioners may just consult because they might not have developed the expertise and the critical skill thinking to figure out the problem on their own. And it's not their fault. It has to do with the training that they received, the training that you received. If you're listening to this, right? And that's the difference in like the training that the medical model get. So that's what I want to impart to my students in my program is that, okay, thinking like a provider is different than thinking like a floor nurse. Family med, almost done. Nice. Congrats. So it sounds like you're a third year. Have you worked with anyone with Huntington's disease? That's more of a neurology thing. We might get consulted, but not really. At what milligram of clomipramine have you seen it helping OCD? Like 100, 150. Are stimulants safe for ADHD? Yeah, that's with comorbid bipolar. Yeah, so you can treat ADHD and bipolar together. You just have to make sure that the stimulants are after the mood stabilizer comes in because you want to make sure you don't want to precipitate a manic episode. Do you prescribe Invega a lot? Decently. I usually just use I just use more risperidone because it's cheaper rather than Invega personally. But you can use Invega. The main advantage of using Invega is that you can switch them to the long-acting paliperidone, which is a month-long LAI, and it doesn't need an overlap. You can directly just start the Invega. I'm taking Olanzapine, but sometimes I drink alcohol too. Is that okay? I mean, it's obviously not ideal, but I understand people are people, right? So what matters more is I just wouldn't take them around the same time because they can both be depressing. Olanzapine's a sedative, it's sedating, and so is alcohol. Is it a red flag if a doctor says you can take hydroxyzine indefinitely on a daily basis? Not really, especially when you're younger. Can you safely taper off Ativan? Of course. Of course, you just have to go slow. If someone's been on Lexapro 20 milligrams for 3 months, but it does nothing, can they stop cold turkey? I would not stop most of your psych meds cold turkey. Definitely not. SSI withdrawal is definitely a thing. Excuse me. Oh yeah, let me pull up. Yeah, so if you want to send me a message, right, either about my coaching program or about booking a consult with me, like a patient consult, you can just send me a message, or check it out in my bio, either or. I used hydroxyzine before I started Lexapro. Worked very well for me. Yeah, hydroxyzine's more for as needed. Lexapro's more for longer term. All right, scrolling through. What do you think about saffron for ADHD and mood regulation? Saffron's not really for ADHD, but it's definitely better for mood. It's good for like depression and anxiety, mild. I had to stop cold turkey due to money. For what med? Most psych meds, we should not stop cold turkey. What's the difference between a psych trained PA and a doc? A residency. Do I do Canadian? Yes, I have consulted with Canadian clients before. I actually do that a lot because a lot of them, they just tell me that the healthcare in Canada, it's just so hard to find a doc and it's so hard to get off the wait list. So yeah. I've been taking doxylamine for every night for sleep. I can't sleep without it. That's definitely not good. I remember one time when I was in med school, I got hooked on Benadryl, and I was taking Benadryl every night for sleep. And it was awful because I couldn't sleep without it. I'd be up till like 3 in the morning, and then I would take it, have to go into lectures at 8, and then I would finish lectures at 12. Then I would take a bunch of caffeine to be able to go to the gym. then go to the gym, and then I would crash, take a nap, and then I wouldn't be able to fall asleep until 3 again, until I took my Benadryl. And it was just like a whole vicious cycle. And like I finally got off because I had one weekend, and I was like, you know what, like this is so dumb. And I just quit the Benadryl cold turkey. I stayed up pretty much the whole night, and then slept a little bit, powered through, and then like reset my sleep, and then it worked. Effexor's too hard on my heart. Any good SNRI? They're all pretty hard. They're all hard because they all stimulate norepinephrine. Use L-Theanine for people on psych meds. Yeah, L-Theanine is not really psych or serotonin based. What makes insomnia go away for good? Sleep hygiene. Look up sleep hygiene. Damn, we got 120 people in here. It's Cat. Where did your specs go, Bakai? I got my specs. When do you work? I always see you on here. I work every other hour of the day. This is my downtime. It's my chill time. But every day is work. Every day is a work day. Honestly, I don't even know what days any day is anymore because they're all work days. Why are there so many SSRIs? So basically, you know, they made one, then they made another, then they made another, and they just make them for profit, right? Because they're so profitable. So, you know, I think Prozac was the first one, and then it really got popular, and then every other company was like, okay, let's make our own, because it got so popular. But no one's been able to make something that like exceeds it. Thoughts about Psych NPs? Well, I run a Psych NP coaching program that has over 100 members who joined in the past 45 days. So I think that should tell you my thoughts on Psych NPs. Are you in residency? I am not in residency. This is self-care. See, this is literally self-care for me. Well, you see, the way that I feel about life and my life philosophy is that life is a video game. And so imagine if you love video games and you could just play a game, you could just play a video game all day, right? And you love games. Like, okay, then life would be amazing then. But now what if real life is the video game? And so every day it's like, okay, I'm leveling up. What am I working on? What are we grinding on? What are we getting XP for? What stat are we leveling up? What achievement are we getting? And every day, so now every day feels like fun to me. Like every day I just work on my business. I work on my, my practice, work on my patient care, work on my psych skills, leveling up my psychiatry knowledge, leveling up my business, leveling up my, gym, fitness life, right? All leveling up my physique, leveling up my social skills, all of that. So now it's like every day's fucking fun because it's like I'm literally just playing a game. And yeah, so it's not, I don't separate like, okay, this is work and now this is like non-work time, right? Like every day's fun. Like I don't even want to go out and socialize. Like, so I'm in Michigan right now, and I'm like I live in New York, but I almost don't want to go back to New York because I'm like, yeah, I just like hanging out here and working. So that's made life so fun for me, is that if I just think of it like a game, and it's super, super fun. I want my son to switch over to speaking to you. Do you need medical records? The best way to do that is if you book a consult on my website, then we can see if we're a good fit to work together. That's the best way to do it. Just send me you can either send me a message or send me a message or just do it online, or like check out my bio, one of the two. Don't antipsychotics take your dopamine away? So wouldn't it be good to use if you have ADHD? No, actually, so it's different. Antipsychotics are anti-dopaminergic in the mesolimbic tract. Basically, it's like a tract that causes and the nigrostriatal tract, basically like psychosis causing tracts. Excuse me. ADHD is a deficit of dopamine in the frontal lobe, so they hit different areas. So yeah, that's why you can always do both of them. Wakas Gondol says, I don't see your physique level enough. All right, bro. Which diagnosis do you consider your specialty? I like general psychiatry. I like all of it. Do you do consultations on call? Yes, so I will call you. So you can book it in my bio, and then I will literally call you. Can you take Wellbutrin and antipsychotics at the same time? Yeah, you can. You can. Yeah, they're different. Yeah. Does SSRI cause hair loss? Not really. More the mood stabilizers cause hair loss. Do you take patients from UK? I have consulted with some patients in the UK. Basically the way it works there is that, usually I'll give advice, and then the person on the other end, you'll have a doctor there, because I can't prescribe there, but there'll be a doctor there, like your family doc will prescribe. Can you be deficient in dopamine in one tract, have a higher concentration in another area? Yes, you can. Just like, in a game, or if you're playing Pokemon, you can have a higher attack stat, but then a really bad speed. Or, you could be really tall, but really skinny, or really short, or really fat. Thoughts on Laura's? Probably a little bit better than Karen's. Is Lamictal dosed? You love video games, huh? Well, my practice is called Level Up Psychiatry. My coaching program is called Level Up Psych Academy. My life philosophy is that life is a video game. So I think that should answer the question. Oh, thoughts on Latuda, LOL. Rather as thoughts on Laura. Oh no, you said thoughts on Laura. Do you watch anime? Oh, now we're talking. Yeah, I do watch anime. Yes. Yeah, I'm watching Demon Slayer currently. That's the main one. I'm just trying to catch up on the last arc. You would know, yes, of course. Yeah, Healthy Gamer. Yeah, his stuff inspired me a lot, actually, because I was in residency when he started blowing up, and I was like, wow, that's so cool. But I like general psychiatry, because he's gone all in on gaming. I like it, but I'm not all fully gung ho on treating a gaming addiction. I like general stuff. I like psychopharm. So that's why I decided to take my career stuff more towards the NP coaching, because I want to be a teacher. I want to teach psychiatry. I was really happy on my psych education. And so, a lot of NPs have come to me and they've said, hey, my psych education was not good. And so that's why I wanted to come in and help fix that. Because I've had so many come to me and say, hey, can you precept me? Can you be my collaborating psych? Can you take me on? Can you teach me? And so I was like, okay, what can I do to do this? Yeah, Psych NP here, and yes. Yeah, literally I've had so many students, so we have over 100 students in our academy now over the last 45 days that have signed up. And a lot of them, what they told me was yeah, I feel like I just don't have any confidence, or in my practice, I feel like I'm an imposter. I'm in some kind of outpatient practice. They have us seeing so many patients a day. I don't know if what I'm doing is right or not. Collaborating psychiatrists are just no, they don't really do anything. I feel like psych and P school didn't really teach me that much. I don't know where to go to learn all of these things. And so that's why I'm okay, I want to create something to help get rid of give a one-stop access where you can learn about psychiatry from me, a psychiatrist who went through residency. I am looking for a preceptor and residing in VA. Yeah, so that's something in our program too. So I'm considering taking on preceptor requests as well, but only for the students in our program, because I get to know them, right? And so they're the ones who I want to invest in. But then I think a future thing I will do also in the program is be able to connect our students with preceptors. So that's going to be a plan too. Do you think Psych NPs are capable of treating bipolar? Doctor once told me they can. No, you can definitely do it, right? Like I literally created a bipolar resource for our program, like where I teach you exactly how to treat bipolar. Let me show you. Bring that up. Oops, rip. Yeah, so if we look here, right, so this is what the program looks like, and so literally I have modules on diagnostic assessments, supplements, right, case discussion, psychopharm, advanced diagnosis, Q&A calls. So if we go to diagnostic assessment, right, so look at all this, right, so all these, like I literally just did the catatonia lecture today, but if you look at bipolar, right, so I've made a bipolar 1, bipolar 2, so now let's look at bipolar treatment, right? So we look at bipolar treatment. So you get a lecture, which I've recorded, as well as a handout. And so literally this handout talks about all the different ways to treat bipolar, right? So you can do first-line treatment of mania, right? So you can do lithium, valproate, SGAs, or like a third gen like criprazine, Vraylar. How to treat bipolar depression. So bipolar is a very algorithmic thing to treat. So yes, to answer your question, NPs can definitely treat bipolar disorder. Okay, where were we? Please give me the detail for this precepting service. Yeah, I mean, so just send me a message. That's the best way to do it. But it's not a precepting service. What I'm saying is that I'm going to be considering precepting in a little bit, but I'm only going to be taking requests from people in my program because I really get to know them. Came to say quick hello before I work on notes. LOL. That's rip. Sorry you have to work on notes. Stalls or Mosby's? I've never used Mosby, so I'll have to say Stalls. Is 75 milligrams of sertraline too much? Sometimes it can be. Yeah, the sweet spot's different. So 75 is not that big of a dose, but the sweet spot just depends from person to person. Is MAD the same as BPD? MDD is not the same as BPD, no. Do you have weekly meetings? Yes, we do have, rip. We do have weekly meetings, yeah. So, literally, if you look here, let me just show you. Right, so, I break it down module by module, right? And so if we look here, there's a module called QA calls. And so literally every week we will have a meeting. So, last one was 429, 422. So pretty much everyone gets a summary, right, of exactly what the meeting contained, all the action learning items. And every week people will ask me questions. So for example, like this week, this would literally be the questions that I'm going to ask this week, right? Or I'm going to answer this week. So drug-induced catatonia, clinical psych interviews, how to interview, right? Amantadine, ADHD coaching, med management, geriatric case discussions, all of this. So yes, do have weekly meetings, and those are actually I love those. Those are actually some of the most funnest things. Like a meeting's supposed to be usually, and we spend about 2 hours on the call too. But you can come and go as you want. You should see Marvel Thunderbolts. Oh my God, rip. I'm not really into Marvel anymore. I got out of Marvel ever since Avengers Endgame. After that, I was like, okay, I think the storyline's done. There's nothing else I need to see. I watched a little bit of Daredevil, but that's it. Other than that, I don't really care. How long after booking a consult does it take to get a call back immediately? Usually 24 to 48 hours. My system will process it and then send it to me. I'm doing Psych NP right now. Yes, so you're probably a really good candidate then if you're someone who really wants to learn psychiatry, if you want to show up for your first job, like feeling confident and not feeling imposter syndrome, right? Like you feel like you know what you're doing. You want to get guidance from other Psych NPs ahead of you, and you want to have a full reference of stuff so that way whenever you practice you can literally just look at it, like get a quick reference to look at doses, look at treatment algorithms for everything rather than feeling like lost, because it will happen. It happened to me. Like I remember when I was in residency, literally what happened was we entered third year of residency and they gave us a whole panel of patients and they're like, okay, have fun. And they just like left. So I had to figure it out all on my own. I was like literally I was Googling stuff between patients. Actually I was Googling meds while talking to patients. Patient would be talking and like I had the computer and I would literally look up the med as I'm talking to the patient. I was looking up to date and other things. So I never had like a comprehensive resource like this. And so I always thought it'd be such a good idea to just have like a one-stop shop where I could ask people clinical advice. I could share, like just go to one place to get all the resources I need. And so that's why I created this. So, and definitely for Psych NPs too, because, I've had so many reach out and they're like, hey, I feel like I didn't learn anything, or I feel like an imposter practicing and I really want you to teach me. Are you in the US? Yeah, I live in New York, but I'm in Michigan now. Yeah. Can we cancel subscription at any time? Yes, you can. Yep, you can definitely. But most people don't. Watch Attack on Titan. Yep, already seen it, my friend. Already seen it. Thunderbolts is basically, yes. As I mentioned, I haven't. I'm not really into Marvel anymore. I have no interest in seeing it. Have you tried Clondine? Considering it? Not a new NP, but considering a new CL position, would your program be helpful? Like, are you an NP? You don't have to be a new NP, just someone who really wants to master psychiatry. So if you're an NP who wants to learn psychiatry, yeah, of course. So I've had like 6 months of experience on the CL. I did CL both in my residency and in my child fellowship as well. So I'm very familiar with all the CL treatments, IV Haldol, CL consults, delirium, agitation, SI, that kind of thing. So to answer your question, yes. If I do a consult, do you prescribe meds? I mean, so there's a consult and then there's a evaluation. The consult's just 15 minutes, and that's to see whether we're a good fit or not, and to see, what I can do to help you. Then the full evaluation is a 90-minute evaluation, and that's different. I read people who do mentorships are so more advanced in their career. Of course, I'm here because of mentorships. Like everything I've learned is from other people. Psychiatry, obviously, I had mentors who taught me psychiatry. Right, I wouldn't know jack shit. I wouldn't be here without this. Social media, I've signed up for social media programs, and like paid a lot of money to sign up for like how to learn how to do social media. Private practice, like I signed up for a program on how to build the psych private practice, and that was 10K. And I was a resident at the time. I barely had that much, but I was like, no, I have to invest in myself. And every time you invest in yourself, that's how you level up, right? Yoda or Luke Skywalker had Yoda, right? Harry Potter had Dumbledore. Everyone has mentors, and like that's how I've come anywhere. It's like mentors and learning, and so you get mentors, and then it goes from there. Hi Chelsea, good to see you. No, no. So subs are from consults are separate. That's a separate thing. That's if you like want to work with me. What are those glasses? So these are dry eye glasses, and basically, so you see this. So now these are normal glasses and whatever, right? But when you combine this, now they're dry eye glasses, and it protects my eyes from getting hurt and like the wind and stuff, because my eyes are just sensitive, and I'm sensitive, but my eyes are also sensitive, and because of this, yeah. Thoughts on Buspar? It's okay. It's mild. It's mild. It's not. It's good for like mild anxiety, maybe moderate. It's good for adjunct treatments, but it's not like severe. It's not the best for severe anxiety. Hello, does guanfacine cause heart palpitations? Not really. It can slow down. Well, it's a sympatholytic. Basically, it's a blood pressure med. It can decrease your blood pressure, so your heart could increase in response to that. Fish oil for dry eyes. Tried it. Yeah, I take fish oil every day, but I need severe stuff. Like I was on super dry eye meds, and I've had IPLs, I've had surgery, like everything. So mine is not like a fish oil curable. I take fish oil every day. That's what I recommend to patients as well, to take fish oil. Can you use them underwater to protect my eyes from getting wet? No, these are not water goggles. But I also need water goggles, or else my eyes will just like blow up and get red. Why don't psych providers usually do blood work, check for things like low vitamin D for mood? It's because you're going to the wrong psych providers. So you got to go to the right ones. For example, either me or the students in my program. Can you touch on why Caplyta isn't used first line for bipolar? Would a $1,500 price tag per month explain? Hello, hey Amaho, how are you? Nice. Can subs DM you with questions specifically? You can, yeah. We have a sub community there too, but you can, yes. So I get a notification when a sub messages a question. Do you have any vitamin D supplements you recommend? Yeah, they're all the same. Vitamin D is like the easiest thing to sub, honestly. Yeah. Yeah. So if it's like a short question, yes, yeah, you can. But I would recommend bigger questions to definitely consult, because like that's when I can actually talk face to face, and not to not just over text, because over text you can only explain so much, right? I have to get, the only way to really help someone is to get to understand their situation in more detail. My son experiences fog with ADHD meds. That's unfortunate. Advice on, yeah, I mean, I think I'd prioritize their sleep too. That'd be another thing. Advice on best SSRIs to use for pregnant patients aside from sertraline. Yeah, Lexapro. All right, see you, Olivia. Yeah, but yeah, nice. But other than that, yeah, I think I'm gonna call it. So it looks like we've been live for about 50 minutes. The Last of Us show, the episode 4 is coming out tonight, so I want to watch that. But otherwise, thank you for staying. And so if you're a PMHNP and you really want to learn from me, you want to learn psychiatry, you're tired of not feeling like an imposter, feeling like no one ever explains stuff, feeling like you didn't get good education, just feeling overwhelmed, or you just want to take your psych knowledge to the next level and like learn from me like a psychiatrist, then I would definitely look at joining our program. That's in my bio. And yeah, if you're a patient and you want to book a consult with me, then the best way to do that is to just check out my bio, and you can book a consult with me. That's the best way to do that. Joel, yes, Joel. I played the game, so I played The Last of Us too, so I know the storyline. But yes, Joel. So yeah, otherwise, yeah, I shall see you tomorrow.